Hello, we are doing today module 3 from nurse delegation diabetic. Right now I already covered 8, 9, 10 in the other video. Right now we're going to do 11, 12 and 13 on this video. This chapter, lesson 11, is the medication administration process and methods of insulin administration. Before we do anything, the book wants us to remind the 6 rights of medication administration. The first one is right client. So we need to make sure right client by asking the client their first name and last name. And if the client is not able to tell you their first and last name, we have to follow the employer or facility policy to determine who you are working with is the correct name. And after we find out, and then we have to match their name with the order of the client. And second is the right medication. Does the medication label match the prescription order? We always ask. You have to be vigilant with look-alike and sound-alike medications. Check the insulin vial to make sure it is right kind of insulin and that there's no clumps or particles in it. The right dose, the right route, does strength and dosage match the order, right time, does the administration time match the order, right route, does the route match the order, right documentation. You have to record everything: client, amount of medication, any side effect, where you inject the injection, those things. These are the 6 rights. And the other thing that you need to remember is you need to check, after you check the 6 rights of medication administration, you need to check it 3 times. You have to check you check the 6 rights of medication administration 3 times before you administer insulin. The first time is at the start of a setup, as you are gathering the medication administration record, insulin, syringe, and alcohol wipes. The second time is during setup, at the time you are drawing the insulin from the vial into the syringe. The last one is after you have the dose in the syringe. Insulin must be injected into the fatty layer of the tissue just below the skin to ensure it will be absorbed. After use, the syringe and the needles must be promptly disposed of properly in a puncture-resistant sharp containers. Do not recup used needles. Most needle sticks exposure occur from recupping or improper disposal of needles. This lesson 11 in detail shows us how a step-by-step guide how to draw one type of insulin into a syringe. First one is we have to check the blood sugar if we are ordered to check it. Always check blood sugar if symptoms of low blood sugar are present, of course. And the second step is we have to check the 6 rights. Ensure insulin has not expired or been open longer than 28 days or other discarded dates. And gather your supplies is the next step. Insulin vial, new syringes, alcohol wipes, sharp containers for used syringes. Check the insulin vial to make sure it is the right kind of insulin and there are no clumps or particles in it. The fourth step is gently stir intermediate or premixed insulin. Intermediate acting, which is maybe in any page, is cloudy and must be rolled between your hands to mix it. Do not shake the bottle. This can make the insulin clump. Turn the bottle on its side and roll it between your palms of your hands. Clear, fast-acting, like long-acting insulin generally does not need to be mixed. And the fifth step is prepare the insulin bottle. If the insulin vial has a plastic cover, take it off. Wipe the top of the bottle with an alcohol wipe. Let it dry. Do not blow on it. and perform hand hygiene and put on gloves. Recheck the 6 rights. The 8th step is pour air into the syringe. Know the dose of insulin you are going to use. Remove the cup from the needle. Pull back the plunger onto the syringe to draw an amount of air that's equal to your insulin dose. You usually draw the air, how much you're drawing first, and you put the air in. And the 9-1 says inject the air into the body. You can inject the air in there. Hold the syringe like a pencil and insert the needle into the rubber stopper on the top of the vial. Push the plunger down until all the air is in the bottle. This helps to keep the right amount of pressure in the bottle and makes it easier to draw up the insulin later. And after you do that, 10th step is draw up the insulin into the syringe. With the needle still in the vial, turn the bottle and syringe upside down. While the vial will be on the top and the syringe will be in the bottom. Then pull the plunger to fill the syringe to the desired amount. And the next step is you have to check the syringe for air bubbles. If you see any large bubbles, push the plunger until the air is purged out of the syringe. Put the plunger back to the desired dose. If there are bubbles, hold both the bottles and syringe in one hand and tap the syringe with the other hand. The bubble will float on the top. Put the bubbles back into the insulin bottle and back to get the right dose. You have to, back and forth until the bubble go out. And remove the needle from the bottle. Make sure that the needle does not touch anything until you are ready to inject. And the 13th one is clean skin at the injection site. You have to select the injection site first and ensuring different site from the previous injection. You need to rotate. Clean with alcohol and let it dry. Keep your shots like 1 inch away from the scars and 2 inches away from belly button. Do not put a shot in a spot that's bruised or swollen or tender. Or do not put the shot in a spot that's lumpy, firm, or numb. This is very common because of insulin not working the way it should. And then on the 14th step, you inject the insulin. Pinching up the skin, I think it shows over here. Pinching up the skin with 1 to 2 inch skin fold, holding the syringe like a pen. Quickly poke the needle at a 90-degree angle into the fold of the skin. If the client is thin, it's okay to use a 45-degree angle. Push the needle all the way into the skin. Let go of the pinched skin. Inject the insulin slowly and steadily until it's all in. Leave the syringe in place for 5 seconds after injecting. Then pull the needle out at the same angle or when in. Do not recap it. And the 16 is place the syringe in a sharp container. Now you're done. Remember, never use syringes. And the 17, gently press the site with a cotton ball or gauze. Do not rub or massage the area. Remove your gloves and perform hand hygiene. Put your supplies away in a clean workplace. Then document site of administration, dose, and time. This is step-by-step guide. It will show you how to draw one type of insulin into a syringe. If you know this guide is kind of easy to get the others. Now let's see mixing 2 types of insulin. How to mix short-acting, which is clear insulin, and intermediate-acting, cloudy insulin. Usually, we say that it's a mixed dose. Mixed dose is usually a combination of 1 faster-acting insulin plus 1 slower-acting insulin. Let's see the steps. Step 1 is first you need to roll and clean. So on this step, you need to wash your hands and dry your hands. And you need to roll the cloudy bottle of insulin between your palms at least 14 times gently, and clean the top of both vials with an alcohol swipe. And the second step is add air to cloudy, which is intermediate acting insulin. Draw the required amount of air into the insulin syringe and carefully insert the needle into the rubber stopper of the bottle of the cloudy insulin. Push the plunger all the way down to inject air into the bottle. Take the needle out of the bottle with the cloudy insulin. The syringe will be empty. Set the bottle of cloudy insulin aside. So first you put the air in a cloudy one and you take out your syringe out. Now it's time to put the air into the clear one. You go into the clear one and you put the air into the clear one. Using the same syringe and needle, put the plunger down to the correct unit mark for the clear insulin dose as ordered. Insert the needle into the clear bottle. Inject air into the clear vial by pushing the plunger down. Leave the needle in the bottle, and then you withdraw. Next step, which is the fourth. Withdraw clear, short-acting insulin first, then cloudy or intermediate-acting insulin next. Turn the clear insulin bottle upside down with the needle in the insulin. All the time you have to hold the insulin at the eye level. And then pull the plunger down to the correct unit mark for the clean insulin dose. You have to support the needle in the bottle so it does not bend. Check for air bubbles in the syringe. Pull the bottle away from the needle and set it aside the clear bottle. Always withdraw clear insulin first before withdrawing cloudy insulin. Now you already put air in both ones. Now you already withdraw the clear insulin. Now we're gonna withdraw the cloudy one. Pick up the cloudy bottle of insulin, turn the bottle upside down and push the needle into the bottle. Be very careful not to move the plunger. Be careful not to push any clear insulin into the bottle of cloudy insulin. Pull the plunger down and withdraw the correct number of units for the cloudy insulin. Pull the bottle away from the needle. Set bottle on the table. Set the syringe down. Do not let the needle touch anything. Units of clean insulin plus units of cloudy insulin will give you total number of units of mixed insulin. We'll go over all this. Now we're gonna do preparing and giving injection using an insulin pen. We're going to do a disposable pens. The steps are very, very similar. Most of the steps that you did on vials work on the pen. We need to check your blood sugar if ordered and follow protocol. Then you have to check the 6 rides, and then you need to ensure insulin has not expired or being open longer than 28 days or other date provided by pharmacist or delegating RN. And you need to gather and set up supplies like pen, needle, alcohol wipe, sharp containers, gloves, and gauze. Then inform the client what you are going to do. Then perform hand hygiene and put on gloves. Then you need to recheck the 6 rides. And then you need to select injection site. Remember, you need to rotate sites daily. Refer to section above on the site rotation for correct procedures. We already talked about it. Gently stir intermediate or premixed insulin. Turn the pen on each side and roll it between the palms of your hands. Clear insulin generally does not to be mixed. Attach a new unused pen end needle all the time. You put needle, screw or click the needle securely in place according to manufacturer instruction, and remove the outer cap from the pen needle, of course, and remove the inner cap to expose the needle. And after that, we have to prime the pen, and then we need to dial to the correct dosage. That means you have to turn the dial to the prescribed dose and double check the dose is correct. Then now you're ready, you have the pen ready. Then you need to clean at the injection site with alcohol swipe and inject the insulin. When you are injecting, pinch up the skin with a 1 to 2 skin fold, holding the syringe like a pen. Quickly poke the needle at 90-degree angle into the skin fold. If the client is thin, it's okay to use a 45-degree angle. While holding the insulin pen in place, release the fold of skin before injecting the insulin and push the dose knob all the way down. Keep the insulin pen in place for 10 seconds to ensure all the insulin is injected. And then pull the needle straight out at the same angle that it was inserted. Lightly press the injection site for 5 to 10 seconds to prevent insulin leakage from the injection site. Then remove needle from the pen. Place used needle in a sharp container. Do not recap it. Just put it in a sharp container the way it is. Remove your gloves without touching the outside of the gloves and dispose of them properly. Perform hand hygiene. Put your supplies away and clean your workplace. Document site of administration, dose, and time. Yes, now you know how to prepare and giving injection using pen. We're moving to the next lesson, which is lesson 12. This one is a very short lesson too. It's about factors that may affect absorption. One is site of selection. The abdomen is usually the fastest site of insulin to absorb, followed by the back of the upper arm, outers here. The yellow one is a faster absorption rate, and the blue one slower absorption rate. And then the last one is outer sides of the thigh and upper buttocks or hips. These ones are the slowest one. Generally, we inject on subcutaneous tissue, which is connective tissue and fat versus muscle. Insulin should be injected into the fatty tissue layer just under the skin. Insulin needles are designed to inject into this layer. Over time, scar tissues can build up, especially if you are not rotating injection sites. Scar tissues will significantly delay absorption. The temperature, heat such as from hot baths or sauna can open up blood vessels, increasing the insulin absorption rate, which while cold can decrease the absorption rate, so the weather can affect the activity level. Level of physical activity impacts how quickly insulin is absorbed by speeding up the absorption of insulin. Certain medications, they also affect. Some medicines, they treat high blood pressure, which helps lower, or some medicine which helps to lower lipids, fats in the blood, can make insulin less effective. And dehydration is the other one. If the client isn't drinking enough fluid, they may not absorb insulin as quickly. Dehydration also increases blood sugar, which can cause a short-term resistance to insulin. When you are dehydrated, it means your blood is concentrated. That means you have a lot of sugar. And make sure the client is hydrated all the time. It's a very short chapter. Now, this is the last chapter, lesson 13. This one is general tips and safety measures. It's very short too, just a general idea. Before using, check the insulin to make sure it's clear. Some insulins are cloudy, that's okay, but the clear insulin one, if it is cloudy, that's not fine. Do not use if the insulin is beyond its expiration date, or unclear, or it's discolored or cloudy. Not that some insulin, like any N, they expect it to be cloudy after you mix them. So that's okay. Or do not use if the insulin has crystallized or some lumps or particles in it, or it's frozen, or bad smelling, or the rubber stopper is dry and cracked. Or do not use bottles insulin past the expiration date printed on the label. And no matter what the expiration date is, throw away a bottle 28 days after you open it. Write the date that you open the bottle on the bottle label, and write the expiration date 28 days later. Discard after 28 days. These are some tips about insulin. Now let's look about syringes and needle pen safety. Faster is better. Inserting slowly will cause more pain. So the key to minimize the pain of injection is the speed. So you want to make sure you are quick, decisive motion, and stick your client at a straight angle. No wiggling the syringe once you have inserted it. Make sure the insulin is at room temperature, and it's not comfortable when they have it on cold. And encourage your client to relax his muscle or her muscle before injecting. And the needle angle is another one. For adults or those with good fatty tissue, insert a 90-degree angle. For teen adults, you may need to inject at a 45 angle. Try to get the needle all the way into fatty tissue below the skin, but not so deep that it hits the muscle below. Injecting insulin. When we inject insulin, we need to put the syringe plunger all the way in with a slow, steady motion, or firmly press the insulin pen injection button. You need to wait 5 to 10 seconds before removing the needle and let go of the skin. When we are removing the needle by pulling and shredding out, twisting or shifting the needle position will cause pain. You may gently press on the injection site with your finger for a couple of seconds, and do not rub or massage the skin where the skin is injected. Can affect how fast the insulin is absorbed and how it acts within the body. Do not reuse syringes. Do not recap needles. And dispose of in a sharp container immediately following the use. These are very, very important to remember. I believe this is the last section is about rotating the injection side. Rotate within each injection site all the time. Most insulins enters the blood faster in the stomach, a little slower in the arms, and even slower in the legs, and slowest in the buttocks. Do not inject close to the belly button, or do not inject close to the wounds or scars. This tissue is tough, and the insulin absorption will not be consistent. If you inject in the upper arm, use only the outer back area where there is more fat. If you inject in the thigh, stay away from the inner thigh. Do not inject in the areas that will be exercised soon. Exercising, usually increases blood flow, which causes long-acting insulin to be absorbed at a faster rate. Thank you very much. This will be the last topic. There's some reviews on here. you can go through it. And after the exercise, after you do the homework, there is a job ad in the last chapter. There's module 1, module 2, module 3. There's a job ad. It's very good. I will advise you to look at it and to study it. Thank you very much.